We like to share stories and tips on wellness and recovery on this show. With more about this in our Walk the Talk segment, here's Kathleen Pichet.
Thank you, Karen. My guest today is Reba Stevens. Welcome, Reba. Reba Stevens knew from a very young age that something was wrong. At 13, Reba experienced issues of abandonment, neglect, and emotional abuse. At 16, she lost her best friend and sister. And at 19, she found alcohol and drugs numb the feelings and thoughts she was never allowed or encouraged to express. 21 years later, after a life of crack cocaine, drinking, and stealing, she was forced to get sober. She was diverted from jail and sent to a behavioral modification home where she had thoughts of taking her life. After moving in and out of 3 rehab facilities, she was clinically referred to Augustus Hawkins Mental Health Center, where her angel, Dr. Lorraine Allman, tested her and gave her diagnoses of major depression, bipolar II, post-traumatic stress disorder, borderline personality disorder, and polysubstance abuse. Having this information gave Reba hope for the first time, and she created a plan for recovery. She continued AA, worked with a doctor, and learned the tools needed to help her be a better person and recover. Reba now works and volunteers for mental health as a peer advocate.
Yes.
It's so great that you're here. Thank you.
Well, thank you for having me.
Once you found out about your diagnoses, what were the types of therapies that really helped you?
Oh my. There was a group, New Possibilities, that was taught or facilitated by my primary doctor, Lorraine Allman. And with New Possibilities, I learned how to relax, to breathe, the importance of what was introduced to us, a wheel with 6 spokes of mindfulness. And it had to deal with noticing what I thought, what I felt, what I wanted, what I will or will not do. And this was the beginning for me, was to understand the importance of breathing, my breath, to relax,
in the moment, right?
In the moment, to be present, to be centered.
And what types of therapies help you now?
Well, I continue to meet with my primary doctor, who's now is Dr. Paul G. Longobardi at Augusta Hawkins Mental Health, and meetings of Alcoholics Anonymous, working with others, helping in the community. And these are all a part of what recovery means to me. It's not about being in a box or being labeled with Department of Mental Health Services. It goes beyond that.
Okay. What is the most important thing about your recovery?
Helping others.
Helping others.
Helping others.
It's part of the cycle, isn't it?
It's
Once you become an advocate, it helps you in your recovery. Reba, what does hope mean to you?
Hope for me means to continue to live the life that I'm living today with improvement, my spirituality, my relationships with others. Hope is, I don't want to seem cliche and say that hope is my future and all of these things in which perhaps could not be realistic for me. Because my hope today is that I can continue to encourage, to empower, and to inspire others.
Right, and that's exactly what you're doing now. Tell us what you're doing now.
Well, right now what I'm doing is I'm, besides working with Department of Mental Health Services, I'm managing a home for men, a transitional living facility. And I'm also out at Compton Family Mental Health as an advocate, a peer advocate, where I'm actually able to assist the clinicians as well as the consumers at large at that particular location. The most important thing that I find that I'm doing today is that I'm a member of the Spiritual Roundtable. And the Spiritual Roundtable is a collaborative partnership between clergy and clinicians of Department of Mental Health in Service Area 6. And what we're doing there is that we're joining hands together to improve the community and to be supportive of the clergy's congregation, consumers at large.
Great, that sounds wonderful, because I know that the clients asked for that spiritual piece for their own recovery. What part of your journey has really set you free? I know that you've really overcome a lot of barriers.
Well, I truly believe that it had everything to do with the confidentiality of Department of Mental Health Services. You see, when I first walked into the doors of the Department of Mental Health, I was homeless, hopeless, helpless, afraid, And the stigma was truly the biggest issue for me. The fact that I was concerned about what other people would think about me or would be aware of the fact that I was a consumer or participating with Department of Mental Health Services. What I have found is that Department of Mental Health Services is truly all about being mentally and emotionally healthy, that it's a safe environment. And I'm just excited to be a consumer with Department of Mental Health because I no longer have to deal with the lies or the deception of others. I get a chance to be free. And this is what freedom is all about. It's just being who I am and present right now and living my life.
That is very spiritual and very inspirational. Reba Stevens, thank you so much for being on Walk the Talk.
Thank you for having me.
Really great.